The International Federation of Health Plans, which represents CEOs of health insurers worldwide, says Americans are paying far more than most other countries for health care. In one example, get this, Americans pay around $32,000 for an angioplasty while paying $6,400 in the Netherlands. So why is it that Americans are paying exorbitantly more? Let's bring in board-certified medical doctor Janette Neshelwat. Janette, thank you for joining us. Dr. Neshelwat.
Good morning. My pleasure, Lauren.
You know, is the obvious question here, doctor, that healthcare is better in the U.S.? That's why it's more expensive, or is that an incorrect statement?
Well, that may be part of the reason, but what it comes down to, Lauren, is it's a fragmented network of health insurance companies. There's no standard. There's no federal oversight. They can charge as much as they want, and for different prices for different services. There's a lack of transparency. You know, prices are going up, but the services are staying the same, and nobody knows what everything costs in advance. And that's why people are upset. They're getting surprise medical bills in the mail, and it's putting them into financial ruin. And on top of that, hospitals have to increase their prices to make up for their losses and the debt that they incur for those patients who are uninsured. And then we have to deal with those who have chronic diseases. That accounts for a huge increase in healthcare costs, such as, you know, heart disease and diabetes and that sort of thing.
So should the government play a bigger role here, as many on the left are advocating for?
You know, we might need a little bit oversight. Just for example, the country of Norway, they spend a third of what we spend here on healthcare. Their government sets benchmarks for standard of care and standard pricing throughout the country, so that they're able to take care of their citizens without putting the citizens into financial ruin. But on top of that, what we have in America that they don't have in other countries is, you know, lots of waste, administrative costs, fraud, and frivolous lawsuits and liability. And then on top of that, a lot of research is conducted by major hospitals in this country. And that research requires funding, requires money. So that's why some of the costs are higher. You know, in addition, you know, hospitals and healthcare providers that are in rural parts of America, sometimes they have to charge extra and raise the prices just to stay afloat and to make up for the lack of business in that community. So lots of factors that play a role here. But I think one of the key points is we have to have transparency and know what we are paying for, what exactly is the cost. Because if we have transparencies, that gives patients choices and options, and that will hopefully drive down prices through competition.
I know. I think a lot of us have sticker shock when we see that bill. All right, there is such a thing called Blue Monday, and it's what, the third Monday in the month of January?
Sure.
Why does this happen? Why do we get depressed in January?
So this happens, it's real, it's not a myth. It's what's called seasonal affective disorder. And what happens is there's a lack of sunlight. When we go outside, the sun hits our skin, a chemical reaction occurs, and it provides us with the hormones and the vitamins and the minerals, vitamin D, that we need to help us function, to keep our mood stable, to keep us happy and healthy. So when that happens, when there's a lack of sunlight, when the weather is bad, when it's gloomy outside, that can change the way we feel, it can change our mood. Then on top of that, we have all these sweets during the holidays. So people eat sugars and carbs. Their blood sugar spikes up, and then it goes down and they crash. So that can really have a negative impact on mood. It can also cause inflammation in the body. But the good thing is, Lauren, there are things and steps we can do to help tackle this, to help combat it. Very simple things. The most important, in my opinion, is to stay active. Exercise, because remember those happy hormones, those happy endorphins that are released when we exercise. So stay active, go outside, go for a walk, watch what you eat, and see your doctor if you're not feeling well.
Dr. Neshelwat, thank you very much.
It's my pleasure.